Well, is the difference between switching your health insurance provider a matter of life and death? Adelup seems to think so. In response to Speaker Cruz's Bill 3, which aims to ensure GUAM chooses the most affordable health insurance option, the governor's spokesperson suggests the savings isn't worth it. Here's more. In his first piece of legislation for the 34th Guam legislature, Speaker Cruz is already finding himself at odds with Adelup, saying he wants to fight against their, quote, multi-million-dollar mistakes. He introduced Bill 3 yesterday, which will amend current law to remove language that would give the administration the ability to choose between a non-exclusive health insurance contract and an exclusive one. This, Speaker Cruz emphasizes, will ensure that GUAM goes with the most economical choice. But the governor's spokesperson, isn't convinced.
Oh my God, Adelup actually argued when Vice Speaker Cruz came out and then, Senator Ben Pangilinan, when they came out with a bill in 2012 saying to move from a single carrier to multiple carriers, the governor had expressed concerns about that. But he does also agree, as does the Lieutenant Governor, that the government of Guam employees and retirees, they all also deserve good quality health care and value health care. Doesn't always equate to the cheapest.
To which the speaker contested.
Then she is grossly misinformed, because there is no difference in the plans. They all have to provide the same thing. And please have everybody understand that there is no cheap one. It's all the services provided have to be the same to be responsive. Otherwise, you won't make it one of the three.
Speaker Cruz went on to say there is no gold and silver plan, but rather each plan is required by law to list all the basic needs. Everybody, he says, has to provide the same medical attention all across the board, adding that he thought the governor would naturally choose the most economical plan, but that's not what he believes happened.
Choose the one that is going to cost you the least, not the cheapest, the one that is most economical. If you go with one, then it'll cost you this. If you go with another, it'll cost you $20 million more. What person in their right mind would go for the one that was $20 million more?
Admittedly, Speaker Cruz shared that they initially opted for quality in the beginning, but Cruz later admitted that it was something the government couldn't afford. Says that in 2012, the late Senator Pangilinan and then Vice Speaker Cruz proposed Bill 435, which she says priced quality over savings.
If the question is, can we afford this? The answer is yes. We've been paying for it for non-exclusive contracts for the last 4 or 5 years now. And that has been to the betterment of, the GUAM employees and retirees and all their families. They appreciate these. Why? Because it's a quality of life issue.
The governor's spokesperson even said that switching to a different health insurance could be, quote, a matter of life and death, saying, quote, of course we want to save money, but save money at what cost?
They're so misinformed, because the one RFP that goes out list everything that all the plans have to include.
The speaker stressed that each health insurance provider bidding in the RFP has to have the same amount of coverage, even noting that in the past, when 1 or 2 providers did not meet the basic standards, they did not make it to the top 3 health insurance providers. You can read Speaker Cruz's Bill 3 online at pacificnewscenter.com.